With our changing food consumption, the number of people suffering from diabetes is still on the rise. As diabetes can lead to kidney failure, it's a concern to a growing number of nephrologists. Until now, little research has been carried out on how diabetes affects PD treatments.
We have some data from registries, but there are very few randomized trials done in diabetics in general, and not many in Europe in particular, I would say. The good PD research we have seen in randomized trials and some in diabetics is from Asia. We've done some studies in Hong Kong, and there's just in the last issue of PDI, Peritoneal Dialysis International, there was a very nice study from Mexico where they have randomized diabetics to use of icodextrin, a starch-based PD solution compared to glucose-based solution. And they found that the metabolic control was much better. And we need more of these studies. This was a relatively small studies, and we also need large studies. I think it's crucial because the culture is different and the genetics are different, and a lot of things are different. I think that a lot of disease is based on the genetics, the environment, the diet and things like that. And I think it's very important that we do studies also in Europe.
Much more research is needed, but what do we know?
Well, I think there's so many things we don't know. We use our common sense and reasoning based on other data, but most of this is based on indirect evidence coming from surrogate markers, for example. We know that it's good with a better metabolic control in a lot of instances. Then we believe that it's good also for PD patients to have a better metabolic control. There's a lot of indication that it may be the case, and then we suggest that the treatment which shows some improvement for the metabolic control is also good in the end for the patient. But there are several steps here, and we really need to confirm all these steps to be sure that we are doing the best things. So we are a long way from knowing that the treatment we're giving in fact improves outcome, even though we have a lot of good arguments for that.
Olof Heimberger expects to see a lot more patients with diabetes in the coming years.
I'm sure that we will see that for many years, and I think it will increase. But my hope is that it will be possible to create research networks within Europe to do randomized trials. And I think we see a little of this development, but it's a very long way to go. And we would really need more money for this type. The European Union gives research grants, but it's extremely complicated to get these grants, and it's a very long and cumbersome process, and we need to have more support for drug industry independent randomized trials, because today the only people who can afford doing trials is the pharmaceutical industry, and it's very good that they do it, but we also need to do other trials where there's no large commercial value but a large healthcare value, and these trials need to have support.
Especially doctors in the US have seen an increase in the numbers of diabetics in the recent years. But is this rise also expected in Europe?
The situation is so much better in Europe, and even though we are in an early US phase, you could say, but still I think it's had so much focus in media and health authorities, and it's so much discussed. So I think, in fact, we may have a better situation. We also do not really have this American hamburger and soda culture. And the other thing which may be very important is that soft drinks in Europe are usually have sucrose, whereas in the United States you use fructose, and fructose may be, our theory is that this may be an important cause of the diabetic epidemic, but I don't think we're sure of that, but there are some indication that in fact the Coca-Cola in the US is worse.